I mean, literally the reason why I created this show, right? I'm not making any money off of it. Like it's called the Alpha Renaissance. Alphas are a small percentage of the population, right? Alphas can be anyone. It can be a person that is motivated on their health, on their business, but these are the people that push the agenda of civilization forward.
Exactly.
Okay. This podcast is not for everyone. I'll be 100% honest with you. It's not. This podcast is for people that want to push civilization forward. It's not just your little group, not just your little country, the entire experiment that we're all living in. And this and because we have to have ourselves fine-tuned, the Renaissance is always happening. That's why it's called the Alpha Renaissance, right? Yeah. Like we're always at the cutting edge of putting humanity forward. That's what the Renaissance did. It never stopped. It's still going, and we're in it.
Now we got the biggest one with artificial intelligence.
Huge.
You know?
Huge.
So if you don't like embrace that, you know, and you're a business person, good luck in a few years.
And I like what you do. Like you're using it in your business model to help you identify candidates and ask them questions based off of their resume. How can I determine what type of, am I getting the A, the B, or the C team?
Yeah, right? I just thought of that the other day. It's like, that could really help us organize this messy system we have, right? So, you know, again, with artificial intelligence, it's funny because 6 months ago I was with Dan, and so I thought, hey, let me design this curriculum so I can be like the expert in artificial intelligence and plastic surgery. So I asked OpenAI, hey, give me all the most popular YouTube videos on plastic surgery and AI. And all of them were older men like my age who were basically saying, robots and AI aren't going to be able to operate like us because they won't touch the skin and be able to do a facelift and be able to do. And I thought, I just stopped my training there because it was like, they're missing the point.
They're missing the point.
AI is to come and make you more efficient, get a better patient experience, organize things better for your office, you know, organize things better for your patients, right? Even in safety. I mean, there's been times when I was playing around with my staff trying to get them to be leaders because they used to just come with me. Here's a picture of someone. And I would say, well, what do you think? You know? And so I said, just go to ChatGPT and ask them the question to act like a world-class plastic surgeon. Here's the issue. Give them the context. 3 weeks in surgery. This is the issue. Give me some advice. And then I said, then look at that and then pick the one that you would pick.
Totally.
And then come to me with the answer that you came, and then we'll discuss it, right? So sometimes it would come and I'd be like, oh my God, I forgot about that option and that option, because AI has the ability to have all the information of the whole world, which I don't have it in my head. I'm humble enough to say that I don't have that. So it can even affect safety.
That's insane.
So why wouldn't you incorporate this into you know what I'm thinking of doing, because I'm struggling with my cells, and I asked my guy and he said, you could probably do it, is just because I was with my son and his fiance, and they talked about how there's studies out that patients like to get interviewed by an AI person than a doctor.
Really?
You could understand that. I mean, the doctors don't have time. They don't care. Like they're busy. So AI will just sit. So I thought, and I've already been thinking about this, have a tabletop with a nice looking person. That, hey, what are you here for? And the thing is, it'll go through, like if I have a system, it's going to hit it every single time consistently and help them get what they want, and maybe even maybe even help them apply for the finance things right then and there. They get, you know, and do it more efficiently. And so I'm thinking like, wow, I think that could work too.
I use it all the time. I mean, I use it as a radiologist. If I need it to, you know, you put in a line or what have you, take a picture of that chest X-ray. It doesn't see the X-ray in color, like opacity and colors. It sees that opacity in pixelation. Right. So it's looking at in the millions of pixels that is viewing. It can say, oh, well, you might not be able to detect it with your eyes, but it can in pixelation, which is powerful. And if you're against that, right, if you're a physician or you're a clinician, you're against that, hey man, hold my beer. It's coming. You're going to be replaced, not by AI, but by other clinicians that know how to utilize AI. Yeah.
Again, the arrogance of you to think that, you know, AI has exposure to all the knowledge of the world, all the public, that you are better than that is crazy, right? And so humble yourself and then say, okay, and then just start, like Dan calls it AI first. He used to call it AI first. So I would say AI first plastic surgery, but it's like more AI empowered, right? So his thing is like, before you hire someone or do something, think about, could AI help me do this?
Yes.
Like, could it be done better than that? And stay lean and see if you can incorporate systems. And so there's nothing to be scared about, you know.
No.
So they say that you're not going to lose your job to AI. You're going to lose your job to somebody who's using AI to do your job.
Totally.
That's who you're going to lose your job to. You know,
I mean, I didn't know anything about production, a little bit, but you know, I used AI to help me organize everything. And I came to the conclusion at the end of the day that I would still have to hire people and I still needed a team. I couldn't do it completely 100% on my own. But guess what? In that process, I learned a lot about every piece of equipment that's involved. If I come into a studio, I can look at the mics and see, okay, they're connecting incorrectly, whatever. All that came from that journey, that part of the journey, right? And you iterate, but AI helped with that. I mean, it increased my knowledge profoundly.
Yeah.